Ever wished you could just hit, like, a reset button on your smile? Start fresh. Well, full mouth reconstruction is kind of like the ultimate smile reboot. We're talking a total transformation, not just visually, but how your mouth actually works, too.
Yeah, it's pretty fascinating how it tackles both form and function. Like, imagine being able to eat, I don't know, a big juicy steak again, or just speak without feeling self-conscious. It can be life-changing, honestly, for folks who've struggled with dental issues.
Totally. It goes way beyond just like wanting a Hollywood smile, right? We're talking about serious issues like teeth worn down from grinding or the damage from gum disease that went untreated, even things you might have been born with.
Exactly. And the thing is, there's no one-size-fits-all approach. It all starts with understanding your needs, your concerns. It's very personalized.
So walk me through it. Where does this journey to a brand new smile, where does it even begin?
It all kicks off with a really thorough consultation. That's where the dentist dives into your medical history, your medications, even your habits. Stuff you might not think is connected to your oral health.
Wait, habits? You mean like how I chew my food or if I bite my nails? That could impact my treatment plan.
Oh, absolutely. Like some medications can affect your gums, and you wouldn't believe the damage grinding your teeth can do over time. It's all connected. The dentist is like a detective, gathering clues to make a roadmap just to you.
Okay, so they've got my medical history, they've seen my nail biting. What's next?
Then comes the examination, up close and personal with your teeth, your gums, how your bite comes together. They're getting the full picture. And then this is where the tech gets cool.
Okay, I'm all ears, laid on me.
They use x-rays so they can see beneath the surface, photographs for the record, and even make impressions of your teeth to create a replica. And get this, all that info goes into making a 3D model of your mouth.
Hold on, a 3D model like something out of a sci-fi movie.
Pretty much. But here's the best part. It lets you actually preview your potential new smile. You can see how different treatments would look and even give feedback.
So it's not just the dentist calling all the shots. I actually get a say in the design process.
Exactly. It's about getting the smile you want, not just what the dentist thinks is best.
Okay, so we've had the consultation, the high-tech scan, even previewed the possibilities. What happens next?
That brings us to the treatment plan. This is where the dentist maps out all the procedures you'll need, and trust me, it can be a pretty long list.
Yeah, I bet it can get pretty involved, especially for like a full mouth reconstruction. Where do they even begin with all that?
Well, it all depends on what you need. They might start with a deep cleaning to tackle any gum issues, or if there are teeth that are, really damaged or infected, root canals might be needed to save them.
Root canals, aren't those supposed to be, well, not exactly a walk in the park?
I think root canals get a bad rap. Dentistry has come a long way. The procedure is much more comfortable these days.
Okay, good to know. So they're cleaning, fixing, saving. What else could be involved?
Sometimes, if a tooth is beyond repair, they might have to extract it. But, don't worry, there are fantastic options for replacing those missing teeth, like implants. And of course, there are fillings, crowns, veneers to address issues with specific teeth.
Wow, it sounds like they cover everything from like the foundation of your gums to the little details of each tooth.
You got it. And the dentist will carefully plan the order of these procedures. Some things need to happen before others to get the best results. It's like building a house. You need the foundation before you start on the walls.
That's a great analogy. So, say my personalized plan is all set. What can I expect when it's time for the actual treatment?
Well, full mouth reconstruction, it's not a quick fix. It's a journey that might involve multiple appointments, spread out over weeks or even months.
I imagine the complexity of the plan plays a big role in how long it takes. But what about the recovery trial for each procedure?
That's a good question. It really varies. Some things, like fillings, have minimal downtime. Others, like implants, need a bit longer to heal. Your overall health and age can affect it too.
So it's a multi-step process, each step carefully planned, and the recovery time depends on a lot of things. Sounds like a pretty big commitment.
It is, but it's also incredibly transformative. And once it's all done, you'll see the amazing results in the before and after pictures. Imagine finally having the smile you've always wanted. That's the power of full mouth reconstruction.
It's really incredible what they can do these days. But before we go any further, let's clear up one thing. Full mouth reconstruction is sometimes confused with a smile makeover, but they're definitely not the same.
Right, they're totally distinct. A smile makeover is more about enhancing what you've already got, like teeth whitening or veneers, mainly for cosmetic reasons. Full mouth reconstruction tackles serious functional issues that impact your overall oral health.
So even if they use similar procedures, the goal is totally different. One is about looks, the other is about restoring health and how your mouth functions.
Exactly. And that difference is important because it could affect things like insurance coverage.
Which brings us to the big question on everyone's mind. How much does all this cost? Because let's be honest, full mouth reconstruction doesn't sound cheap.
You're right, it can be a significant investment. But remember, you're not just paying for materials and procedures. You're paying for the expertise of a skilled dental team and the chance to, transform your life.
That's a good point. So give us a ballpark. What are we talking here?
Well, a basic plan might start around, say, $15,000, but a more complex one could go up to like $80,000 or even more. It really just depends on your case and what procedures are needed.
Wow, that's a pretty big range. What are some of the things that would push the cost to the higher end?
Well, certain procedures are naturally more expensive, like implants or jaw surgery. And the materials used can also make a difference. A gold crown is going to cost more than a porcelain one.
Okay, makes sense. And what about insurance? Do they usually cover any of this?
There's no easy answer, I'm afraid. Insurance coverage for dental procedures is, complicated, to say the least, and it varies wildly from plan to plan. Some might cover part of medically necessary things, like root canals, but offer very limited coverage or exclude major procedures altogether.
So it's a guessing game until you talk to your insurance.
Not exactly a guessing game, but you definitely got to talk to them. Get the specifics of your plan and what it covers. And just as important, talk openly with your dentist about the costs and potential insurance coverage. It can help you navigate all that and explore your options.
So it's a team effort, you, your dentist, and the insurance company all working together.
Exactly. And hey, a lot of dentists offer financing options or payment plans to make it more manageable.
That's good to hear. So even if it seems like a lot at first, there might be ways to make it work, but we're just scratching the surface here. Let's take a moment to process all this info, and when we come back, we'll delve even deeper into the specific procedures involved in full mouth reconstruction. Welcome back. Okay, so we've laid the groundwork. Now let's get into the nitty-gritty of full mouth reconstruction. We talked about a bunch of procedures, but I'm ready to dive deeper. Let's start with those root canals. Everyone's favorite, right?
Well, there might not be the most loved dental procedure, but they really are remarkable. Imagine a tooth, like right on the verge of needing to be pulled, causing you pain, maybe even leading to more problems later on. Well, a root canal can actually give it a second chance.
Okay. That doesn't sound as scary as I thought. So instead of pulling the tooth, they kind of just like deep clean it and seal it up.
Yeah, that's a good way to put it. They remove the infected pulp inside the tooth, which is what's causing all that pain. Then they clean it really well and seal the canals to stop any further infection. It's like a fresh start for that tooth.
So root canals are actually like little tooth-saving superheroes. I feel a lot better about them now. Let's talk about the foundation of a healthy smile. The gums. You mentioned periodontal treatment before. What exactly does that involve?
Oh, you're so right. Healthy gums are essential for a strong, beautiful smile. Periodontal treatment, it's all about tackling gum disease, which is basically an infection in the tissues that support your teeth. And if you don't treat it, it can lead to bone loss, even losing teeth.
Yikes, that sounds serious. But what's the treatment like? Is it just like a fancy way of saying deep cleaning?
Well, it can start with something as basic as a really thorough cleaning, above and below the gum line to get rid of all that plaque and tartar. But in more serious cases, it might involve scaling and root planing.
Okay, now I'm picturing tiny little tools scraping away at my gums, and it's making me squirm. Tell me more about the scaling and root planing thing. What is that?
Think of it as a deep cleaning for those hard-to-reach places your toothbrush just can't get to, below the gum line. It smooths out the roots of your teeth, so it's harder for plaque and bacteria to build up.
So it's like hitting the reset button for your gums and giving them a chance to heal. That makes sense. What happens if the gum disease is really, really bad? Is it a lost cause?
No, not at all. There are actually surgical options. They can repair damaged gum tissue and even, believe it or not, regenerate lost bone. It's amazing what they can do these days.
Wow, seriously, I had no idea. So we've got the root canals, saving teeth, and the periodontal treatments, giving those gums a fighting chance. But what about those teeth that are just like too far gone? That's when extractions come in, right?
Exactly. Extractions, they're kind of the last resort. But sometimes they're necessary, like to get rid of an infection, stop the pain, or even to make room for other procedures like implants. It's not just about taking out a bad tooth, it's about creating a healthier environment for the rest of your mouth.
So it's like pulling a weed in your garden to help the other plants grow. Okay, but what about the gap that's left behind? That's where those dental implants come in.
You got it. Dental implants are a total game changer for replacing missing teeth. There are these titanium posts that are surgically placed into the jawbone, and what's wild is they actually fuse with the bone over time.
Titanium, like they use in airplanes. Seriously. So it's not just a fake tooth sitting there. It's like part of your jaw.
Exactly, and because they're so secure, they work just like natural tooth roots. They give you the stability and support you need to chew and speak. Then they attach a custom-made crown on top, and Voila, you've got a replacement tooth that looks and feels natural.
It's crazy how far dental tech has come. So we've got the implants replacing those missing teeth, but what about the ones that are still hanging in there, but, maybe looking a little worse for wear? Fillings, crowns, veneers, that kind of stuff, right?
Right on. Think of those as the cosmetic and restorative heroes of dentistry. Fillings are the workhorses. They fix cavities and little bits of damage to the tooth structure. Crowns are more like protective caps that cover the whole tooth, restoring its shape, strength, and looks.
So if a tooth is cracked or weak or just looks a little rough, a crown comes to the rescue. Okay, what about veneers? Those seems to be super popular these days.
Veneers are definitely having a moment, and it's no surprise. They're these thin, custom-made shells that are bonded to the front of your teeth, and they can really transform your smile instantly. They can cover up stains, chips, gaps, even minor misalignments.
So if you're going for that Hollywood smile, veneers are the way to go. But what if you need more than just cosmetic fixes? Like, what if your teeth are actually crooked? That's where orthodontics comes in, right?
You nail it. Orthodontics is all about moving teeth into the right position so they look better and your bite works better. And while those traditional braces are still effective, there are also these really cool, discrete options like clear aligners.
Oh yeah, the invisible braces.
Exactly. There are a series of clear, removable trays that gradually shift your teeth. You can barely see them, and you can take them out to eat and brush, so they're really popular with adults.
So we've covered a lot. Root canals, gum treatments, extractions, implants, fillings, crowns, veneers, even orthodontics. But there are a couple of big ones we haven't talked about yet. TMJ and orthognathic surgery. These sound pretty intense.
They are, but they can also be incredibly life-changing for people who have jaw problems. TMJ surgery, it deals with problems in the temporomandibular joint, which is that hinge connecting your jaw to your skull. So it can help with pain, clicking, popping, and improve jaw function for people with TMJ disorders.
So if your jaw is always clicking or you have chronic pain, TMJ surgery might be an option. But what about orthognathic surgery? That sounds even more serious.
Orthognathic surgery is all about fixing jaw misalignment. Imagine having an underbite or overbite so bad that it makes it hard to chew, talk, even breathe. Well, this surgery can realign the jaws, which not only fixes your bite, but can also improve your facial appearance.
Wow, that's amazing. It sounds like it can really make a difference for people with those kinds of problems. Okay, so we've gone through the whole range of procedures from simple fillings to jaw surgery, but let's not forget about what comes after the treatment, the recovery.
You're absolutely right. Recovery and aftercare are super important for making sure your investment, lasts. And since everyone's different, your dentist will give you specific instructions based on what you've had done. But there are some general things that apply to most cases.
All right, let's talk recovery basics. What can people expect in terms of discomfort and downtime?
Well, right after some procedures, you might have some swelling, tenderness, or just feel uncomfortable. Your dentist will probably give you pain beds to help with that. And ice packs are your best friend to reducing swelling.
Makes sense. And what about eating? Any restrictions there?
Oh yeah, especially at first. You'll need to stick to soft foods that are easy to chew and won't irritate the areas that are healing. Think soups, smoothies, yogurt, mashed potatoes, all that good stuff.
Okay, so no steak and chips for a while. Got it. But what about keeping everything clean? I bet oral hygiene is super important while you're healing.
For sure. Your dentist will give you detailed instructions on how to brush and floss carefully around those surgical sites. It's all about keeping things clean without messing with the healing process. Gentle is the key word here.
Got it, gentle brushing. What about those night guards we talked about? Do those play a role in recovery?
They often do, especially if you're someone who grinds or clenches their teeth. A night guard can protect your new restorations, keep them from getting damaged, and it can also help keep everything aligned if you've had any orthodontic work.
It's like a bodyguard for your new smile. Okay, but how long does all this recovery usually take?
That's tough to say because it really depends on you and the procedures you've had. Simple fillings might heal in a few days, while implants can take months to fully fuse with the bone. Talk to your dentist. They'll be able to give you a better idea of what to expect.
Got it. Patience is a virtue. And remember, you're not in there alone. Your dentist will be there to check on your progress and make any adjustments as needed. All right, let's talk about the other big thing, the financial side of all this.
You're right. Cost is a major factor for anyone thinking about full mouth reconstruction. And since it involves multiple procedures, the price tag can vary a lot depending on what you need and how complex the treatment plan is.
Okay, so how do we break down the cost? What are the things that really drive up the price?
Well, it's like the more procedures you need and the more complex they are, the higher the cost is going to be. A single filling is way cheaper than a dental implant or jaw surgery.
Okay, so if I need a mouthful of implants and some serious jaw work, I'm looking at a bigger investment. But what about the materials? Do they affect the cost too?
Absolutely. Some materials are more expensive than others. For example, a gold crown is going to cost more than a porcelain one.
So the materials matter too. What about where you live? Does that play a role in the cost?
Location can sometimes be a factor, but the biggest thing is really the complexity of your case and the procedures involved.
All right, let's talk about insurance. Does insurance usually cover any of this?
Well, insurance coverage for major dental work can be a bit of a maze. It's really different from plan to plan. Some plans might cover some of the medically necessary things like root canals, but might not cover much or any of the things they consider elective like veneers.
So basically, you got to talk to your insurance company to find out.
Yeah, it's important to have that conversation up front. Call your insurance provider and get the specifics of your plan, and then have an honest conversation with your dentist about the estimated costs and what insurance might cover. They can help you understand everything and explore your options.
So it's about you, your dentist, and your insurance company working together, right?
Exactly. And remember, lots of dentists offer financing options or payment plans to make things easier.
That's great to know. So even if it seems overwhelming, there are ways to make it work. But we've covered a ton of information today, so let's take a little break. When we come back, we'll wrap up our deep dives into full mouth reconstruction with some final thoughts and things to consider. All right, welcome back. So we've really gone deep on full mouth reconstruction, haven't we? Consultations, the technology, all those different treatments, even the recovery process. But now it's time to tackle the big one, the cost. You know, that thing everyone thinks about but no one really wants to talk about.
Yeah, you're right. Cost is a big concern. And because full mouth reconstruction is so personalized, the price tag can be all over the place. It really comes down to what you need and how complicated the treatment is going to be.
So I'm getting there's no easy answer, no magic number when it comes to cost. Can we break it down a bit for our listeners? What are the things that really make that price go up?
Sure, think of it like, I don't know, building a house. A simple shed is going to be way cheaper than a huge mansion, right? Same thing with dental work. A basic filling is going to cost a lot less than, say, a dental implant or jaw surgery.
Okay, that makes sense. The more complex the procedures, the higher the cost. What about materials used? Does that make a difference too?
Oh, definitely. Some materials are pricier than others, like a gold crown is going to cost more than a porcelain one, just because of the materials themselves. And some veneers are more expensive than others, depending on the brand and how they're made.
So it's like choosing fancy countertops versus a basic laminate. You get what you pay for. But let's be real, most people aren't exactly swimming in cash when it comes to dental work. So let's talk insurance. Can we expect any help from them?
Well, insurance coverage for big dental procedures, it could be tricky. Every plan is different. Some plans are pretty good with covering the things that are considered medically necessary, like root canals. But then others might only cover a small portion or none at all for the things they see as elective, like veneers.
So how do you even figure out what your insurance will cover? Any tips?
Honestly, the best thing to do is call your insurance company directly. They're the ones who can tell you the specifics of your plan and what it covers. But don't stop there. Talk to your dentist too. Be upfront about the estimated costs and what your insurance might contribute. They can help you navigate all that and make sure there are no surprises.
It's all about communication, right, with your dentist and your insurance company. But what if, even with insurance, the cost is still too high? What other options are there?
Well, the good news is a lot of dentists offer financing options or payment plans. So you could spread the cost out over time. They get it. Not everyone can just pay a huge amount up front.
Okay, that's good to know. So even if it seems overwhelming, there might be ways to make it work. But beyond the financial aspect, how do we weigh the investment against the benefits? It's a big decision.
It really is. But imagine being able to bite into a crisp apple without any pain, or smile without feeling self-conscious. Full mouth reconstruction isn't just about fixing your teeth. It's about improving your overall health and how you feel about yourself. It's an investment in, well, you.
That's a great way to put it. So as we wrap up our deep dive here, what's the one thing you want our listeners to take away from all of this?
If you're dealing with dental problems that are affecting your life, don't wait. Whether it's pain, trouble eating, or just not liking how your smile looks, explore the possibilities. Full mouth reconstruction might seem like a lot, but it can truly change your life.
It's about getting your smile back and your confidence too. So here's a little something for our listeners to think about. If you could have any smile you wanted, what would it look like? Picture it in your mind. And once you have that image, don't be afraid to reach out to a dentist and see what's possible.
I love that. And remember, taking care of your oral health is so important. It's an investment in your overall well-being.
Absolutely. We hope this deep dive has given you all the info you need to make the best decisions for your smile. Thanks for joining us on the deep dive.